welcome, Gayatri. And
you.
the other gentleman that you guys are watching on Facebook Live is Acharya Srenan.
Nanda.
Nanda.
Surya Nanda.
Sorry.
Thank you. Thank you
Welcome
for
to
having
our
me.
show, sir. How are you?
I'm fine, and thank you for having me.
Yes, thank you for being here. Would you like to introduce yourself?
Yeah, my name is Surya Nanda. I am Acharya at Arya Samaj, Greater Houston.
Yes, yes. Thank you for being here, and we are excited to hear from you as well.
Yeah, thank you.
So let's begin with the show. So what is the difference between blood and blood stem cell donation?
Let me tell you a story.
Oh yes, I love your stories.
It's a story of a kid who's 13-year-old, very smart, very intelligent, handsome, dashing kid who's full of energy. But he was not like that before. This story started when he was born. He was such a cute kid, like gully cheeks and very fair, like any mother would want that kind of kids. Very cute. Looked so pretty. It's like really full of life. That's what it looked. But he was born with the disease called beta thalassemia major. So what does it mean is he looked like normal children. He ate like normal children. He did all those things, but he needed blood transfusions very frequently. That was as a temporary treatment. For a cure, he needed one blood stem cell transplant. For 10 years, he received more than 400 blood transfusions. Amazing people we have around us who keep donating, and patients like Rushi keep receiving blood transfusions.
Yeah.
And he does not know that he received more than 400 blood transfusions, and who are those donors? Because we have a wonderful system. Anybody like Rushi goes to the hospital who needs the blood transfusions, there's a system that the hospital is able to provide them blood.
Yeah.
Because we have blood banks. Anybody who wants to donate blood, who qualifies, can go and donate anytime. After the blood donation, the blood bank does the typing of the blood and process the blood, package, manufacture it, we call it, and it is sent to the hospital where whoever is in need, the hospital provides that blood. So the blood stays on the shelf. We have amazing, like so many people, hundreds of people donate every single day.
Wow.
And that is life-saving blood. Since 400 plus transfusions Rushi received, he could wait to find one matching donor. Irony is he doesn't know who are those people who have donated.
Yeah.
But who donated him blood stem cells, he knows that person. So that is the main difference. The blood can have, after the blood donation, the typing is done and it is given to the patient, and we don't know who gets that blood. Whereas for the blood stem cells, first we find a matching donor, then donor gets to donate.
Right there.
Yes, and it doesn't have shelf life. Usually within 24 hours to 48 hours, it is given to the patient. Not 100% time, but usually that's how it works.
Wow. That's a very good way of like explaining what blood transplant or
Yes, transfusion and the blood stem cells. So basically what happens is the blood stem cells are the blood making cells. They are responsible for producing blood, different blood components, whether it's red blood cell, platelet, plasma, all they come from blood stem cells. So in case of Rushi, his blood stem cells were not functioning properly. So he needed blood transfusions. Now he has received one blood stem cell transplant from his matching donor. Now he is producing good blood. So he does not need blood stem cells anymore. So he's capable of producing his own healthy blood.
Love it.
Yeah. It's,
So what type of testing is this?
oh, this is for the blood stem cell transplant. Patient and the donor's HLA type needs to be matched. These are human leukocyte antigens. And the patients like who has blood disorder like Rushi had thalassemia, other diseases are the sickle cell, leukemia, and all those patients, they need blood stem cells from a matching donor. And the testing is simple cheek swab test. I love to show that. It is Q-tips you rub in your mouth, not in the nose.
Yeah. It's not a COVID test.
It's not a COVID testing. It is just, it goes in the mouth.
That's simple.
That's simple. And you can do this testing at home also.
Oh, wow.
So what happens is it, when you do this testing, you send this kit back to the lab, and within 4 to 6 weeks, we get the results. And once we have the results, you become part of the donor database, where we have more than 14 million people just in US.
14 million.
14 million people.
That's an amazing number.
Amazing number. And from there, if you match any patient, you will be contacted, and then we do the medical evaluation. And if you qualify, then you get to donate.
Oh, wow.
Whereas in the blood donation, first you get
Yeah.
testing done, and then you get to donate. So that is the main difference between blood donation and blood stem cells donation. And testing is super easy. You all did that, right?
Yes,
I
we did.
think-
When we first had you on the show, like, testing is like, let's go
Yes.
do this.
Yeah. So like, it is so hard to find a matching donor. Like for Rushi, it took him 10 years to find a matching donor, and his donor is Dr. Ketan Bakriwala, who lives in California.
Oh, wow.
So donor, in this case, donor and the patient doesn't have to be in one city. They could be in 2 different parts of world.
Yeah.
Means living in US, living in Houston, you could match somebody in New York, Canada, India, Pakistan, Europe, anywhere. You give your donation in US, and that donation is given to the patient. Just like Rushi got a new life. Basically, it is
Yeah.
second lease at life.
Wow.
Your donation, you can give that. You just not save one life, you save the whole family.
Yeah.
You look at his mom, his dad, the dadi, nani, everybody is so happy ever since he received the transplant.
Yeah.
I remember the day when Rushi met his donor. Everybody, his family, his dada, dadi, kept crying, and they were like, they were so happy. Those were happy tears.
Yeah.
They waited for this day for years. And one stem cell transplant changed their
everyone's
life.
Yeah.
Changed their life.
Wow. What a sense of relief they must have felt.
Oh yeah, it is like what his daddy said, Kina, I was living for this day. She was so emotional. She said that भगवान अब मुझे कभी भी ले जाए, जो मेरी तमन्ना थी ना, वो पूरी हो गई है. It's life.
Yeah.
Now Rushi doesn't need to go for any blood transfusions. He plays sports. He craved for playing sports. Earlier, he was getting blood transfusion, and blood transfusions were like charging the battery.
Yeah.
So he needed to get charged again and again. So he didn't have full energy.
Yeah.
He could not play sports. We used to say he just loved to watch TV and play games. But actually thing was that he didn't have energy.
Yeah.
Now you cannot make him sit even for 5 minutes.
I love it.
That's
He
changed.
got his life back.
He got his life back. And coming back to this thing, how testing is done, it is as the HLA typing. And the important component is that the patient and the donor's HLA type needs to be matched. And these HLAs are inherited from parents.
Oh.
So we have 10 main markers. A set of 5 come from mother, a set of 5 comes from father. So anything that is coming from parents, it's not a perfect match for a child.
Yeah.
Parents are going to be the 50% match most of the time. And then it says the siblings, only 25% chances for siblings to be a match. So in Rush's case, his sister was not a match. So it took him 10 years, but now he is happy. So another thing is patients have a better chance to match someone who share their ethnicity, and for the same reason, because these HLAs are inherited from generation to generations.
Yeah.
So if any South Asian person needs a match, probably the other South Asian could be
The donor.
donor.
That's interesting.
Yeah, the interesting thing is Rushi and his donor Ketan Bakriwala, they both are back from Surat side. And they didn't know anything about that when their ancestors, like Ketan, he doesn't remember when he went to Gujarat last time. But that's the originated of the our gene pool is very important. It gets passed on from generation to generation.
That's very cool.
Yeah. So to help our people, we need help from our community.
Yes, absolutely.
Yeah. And and one of you said that it's like we are the medicine, basically, that we are carrying the medicine all the time. We can donate blood stem cells, and it cannot be manufactured in a factory.
No.
You cannot go purchase from anywhere else. First, a human needs to donate, and then we can do the processing to give to the patient. But originally, it has to come from only a human being.
Right. And it's
Yeah.
so amazing. They always say that we are connected, and this is truthfully scientific.
It shows.
It shows.
that we are all really connected.
We are all connected. Yeah.
Like, this is a message that I want to send to our listeners. Like, if you're listening today, it takes 2 minutes of your time. All you have to do is do a swab, and you don't know whose life you can save. It literally takes 2 minutes.
It just takes 2 minutes.
And,
Just
yeah.
take the first step.
Take
And
the
how?
first step.
Yeah, how you can order that swab kit? Go online on your phone, text CURE CURE to 61474. Text CURE to 61474. You get a link. You fill up the form. It takes 2.5 minutes to fill that form. That is it. And the kit is mailed to you if you are between the ages of 18 and 40. You are eligible to do that, and it's completely free. It comes in an envelope that is already addressed and stamped. So all you need to do is swap and send it to the lab.
Wow.
That easy.
Okay, so you already answered who can test and register. So, so the question that I had asked for you earlier was, after 40, can you still donate, or is there an age restriction?
Sure. You are eligible to register if you are between the ages of 18 and 40. And the research shows that more than 75% of the time, doctors chooses the donors who are between the ages of 18 and 35. So once you give the samples, you are eligible to stay on the registry until you turn 61, but chances for you to be called are very slim.
Oh, very slim.
Yeah. And the reason is that the younger donors provide better outcomes
Yeah, that's
for
what I was
the
going to ask you
patient.
next. Like, why is age so important? But
Yes,
that makes
yes,
sense.
because, yeah.
Your stem cells are younger.
Younger.
Yeah.
Yeah. And it provide better outcomes.
Okay. So, is it true that people can donate to the patients of their ethnicity? And we did discuss this. Just
Yes.
right now. So, organ donation. Who can be an organ donation? Do we want to discuss this after
Let's-
the break?
Yes, let's do that.
So I have a list of questions for you. So, what are the potential benefits of using blood stem cells in medical treatment?
So many diseases, there are more than 75 diseases that can be treated with the help of blood stem cell transplant. Just few to name, like aplastic anemia, sickle cell anemia, thalassemia,
Wow.
leukemia. They are just a few, 75, more than 75 diseases can be treated.
Wow.
Yeah.
Okay, and how does the process of blood stem cell donation work?
Most of the time, donation is similar to platelet or plasma donation.
Okay.
You remember that when the COVID was at the peak, we needed the plasma donors, convalescent plasma donors, and so many people were donating. So the blood stem cell donation is similar to that. What happens is that donors donate blood, and that blood goes through a machine, and that separates out the blood stem cells, and rest of the blood component return back to donors at the same time through the other arm. It just takes 3-4 hours, and after donation, donors go home the same day. The best thing is, while you are donating, you can watch TV.
Yeah.
Your friends and relative can give you company. You can eat, you can drink. Only thing is, you need to be in that chair
Yeah.
for around 4 or 5 hours. And even though you are donating for 4 or 5 hours, you are not going to lose much, because before donation, you are going to get medicine to produce more cells.
Oh.
So basically, you will be donating the cells that you will be making more. So you don't lose anything.
How long does it take a person to regenerate those stem cells?
Actually, in this one, so what happens is 4 days before the donation, donors start getting medicine. It's just an injection that you can take on your own, just like you take the diabetes injections. So you can take on your own. And for 5 days, you take that injection. And for the first one, when you take, you are in the facility, so that we monitor it, that to make sure that you don't get any side effects. I haven't seen anybody getting through any side effects, but we do take that kind of precautions. And after that, you can take that medicine on your own. So with that medicine, what happens is you produce more cells. And on the day of donation, you donate only the cells that you have produced more
of.
already.
So you're not really losing out on what
Yeah.
you already had.
Yes, so 90% of donations are done through this method. There's another form of donation that is called traditional marrow donation. In that, the blood forming cells, the stem cells, are harvested from the hip bone. That is their home. So doctors use special syringes to get into that bone and withdraw those liquid cells. And in this, it takes anywhere around 20 to 45 minutes, and it is done under anesthesia. So when you are sleeping, obviously you are
Yeah.
not feeling any pain. And after donation, mostly people go home the same day. They do feel a little sore for a few days, but most of the donors say that they resume to normal life within 2 days or so.
Oh, wow.
Yeah, 100% recovery may take a few more days, but
Right.
yeah, people resume to their normal life. And 10% of the cases, we do get this kind of request. And remember in the beginning, I told you the story, Rushi?
Yes.
Ketan donated through marrow.
Oh, wow.
Yes, that's how he donated, and he was back to work in, I think, 3-4 days.
Oh, wow.
Yeah, that is it. Yeah, and he's a young father. He has 2 kids, and the family. He went back to his normal routine within 3-4 days, and look at Rishi. What he got the new life. Yes.
You know, this is off topic, but 2019, I had done a similar procedure for myself, a stem cell for my back.
Oh,
So they took my stem cells and injected it on my back. Same way, but different for different reasons.
yes,
But
because
yeah.
the stem cells are the basic cells. They
Yeah.
reproduce more cells. They are
Yeah.
different kind of cells.
Yeah.
So you got the different stem cells, and this way, for the blood cancer and the blood disorder patients, they need blood stem cells.
Yes.
That's
Yes.
it.
Yeah. Yeah. I thought it was kind of cool though.
Yeah.
So, what criteria must a person meet in order to be eligible for stem cell donation?
Number one is, for registration, you need to be 18 to 40.
Okay. Yes.
And if you have traveled, you are still eligible. So sometime if you have traveled
Outside
outside of US, so sometimes for the blood donation, it's like if you have traveled outside of the country, you are not eligible for blood donation. That is not the criteria for blood stem cells. And because first of all, you're just giving your cheek swab samples for the testing. So if you are taking any medication, like antibiotics, or you are under the weather or something, or you had tattoo, you have traveled, you are eligible for this one. And another thing is, when you try to you fill up a form, it does ask you some health questionnaires. And the basic thing is, if you are in normal good health, you are eligible to register. And of course, you go through that questionnaire. That is the pre-screening. You do that, and if you qualify, then you move to the next step. But most of the time, if you are in good health, you are eligible. Now, if you are identified as a match, we do a good, very in-depth medical evaluation. And that is, we do the blood test. And with that, we test three things. Number one is, it's called the confirmatory testing, to make sure that you are the actual match. Secondly, we check for the infectious diseases, because when donors donate, and those cells given to the patient is like a newborn baby. And so if a donor has any kind of infection and donor doesn't know, and if get passed on to the patient, it could be life-threatening. So we do that. Okay. The third, the most important thing is, we want to make sure that donor is medically eligible. So all those tests are done. We make sure that all the vitamin levels are good, all the organs are good, very in-depth. And sometimes it takes few weeks to get those results. And if somebody is a perfect match, doesn't have any infectious diseases, is perfectly healthy, organs are, and the other things are good, but the vitamin levels are low. Vitamin D is low, B12 is low, and all those things. Iron is low, that happens a lot of time. With that, we can easily treat that.
Right.
We give the medication, and it may take few days. Once it comes to the acceptable level, and then donors can get to donate.
Okay.
Yeah.
So even with your wear.
Yeah. As long as you are in good health.
Yeah. Overall good health.
Yeah.
Okay. Well, let's hold that thought. We're going to take a quick break. You are listening to your Chai Time Girls on 103.5 Hum FM, and we will be right back in a short break. Welcome back to Chai Time here on 103.5 Hum FM. For those of you that have just tuned in, we are in conversation with Gayatri and Acharya from
NMDP.
NMDP, formerly known as Be the Match. We are talking about blood stem cells and organ donation. So before we went on break, we were going to get to this next question, which was, what advancements or breakthroughs have been made in field of blood stem cells research and transplantation?
So the latest research that shows that even if the donors are not perfect match, means it could be 70%, it could be 60%, so we call it mismatched donors, but they are younger and healthier donors, they provide good outcomes.
Okay.
So it is much easier to find partial match rather than a perfect match.
Yeah.
So it means better hope for all these patients who are in search of the transplant. But the only thing is that we want younger donors, so that is the reason we want people, our youth, to learn more about this cause. We do a lot of events in colleges.
Okay.
All mainstream colleges, we do events, and it's amazing how these youngsters are doing, like 18 years, 19 years, 20 years. So we have a really good database from 18 to 22, because the college students are very much getting involved.
Yeah.
And a lot of the athletes, the football or the basketball, all these athletes are coming forward.
Wow, that's amazing.
Yes, and I don't have the number, but many of those, the players have donated.
Love it. I mean, they're so healthy, so I think that would be the
And
perfect.
Yes, and they provide really good outcome for the patient. When I say donated, means they registered, then they matched,
Oh.
and then they have donated.
Donated.
Yes.
Wow, that's amazing.
Yeah.
So, are there any potential risks or side effects associated with blood stem cell donation?
See, blood stem cells is a medical procedure.
Right.
Right? So everything has some kind of like effect. Like the Tylenol has some side effects,
Yeah.
right? But we do take the Tylenol
Yes.
when needed. There are some side effects driving on the road, right? But we all drive.
Yeah.
Everybody drove over here. The same thing, there are very rare side effects for that, but I've been working here for last 15 years. I have not come across anybody who said that he had some long-term side effects. Temporarily, yes,
Yeah.
some might
I mean,
feel
with
headache or
anything, like you
body ache.
said.
Yeah,
Yeah.
you resume to normal life.
Yeah.
Yeah,
You can't stop living, right?
yeah, yeah.
So, are there any alternative methods?
So there are research going on. I know the biotherapies, but I'm not a medical professional,
Right.
so I cannot talk about those.
Of course.
But one thing that I know that this advancement, that the mismatch young donors, it is definitely bringing a lot of hope for many, many patients.
Wow.
Yeah.
You know, I have to give kudos to you because, like, you are up and about at every event, at every organizations, anything that there is. I always see you, and you're there, like, spreading awareness and letting people know, hey, you know, come down, donate. It takes a lot, and you're like one person that I see, but it's like an army. Like you yourself are an army.
Yeah.
That
Very
is so
electric
sweet.
in
Yes.
a good way,
That
right?
is-
Like you transfer that energy where you're enthusiastic and excited
Yes.
to donate. Like
Yes.
so you have to be
I
really
mean,
passionate to do
With our first show, we were just like, where do we do this? You know? So yes.
See, I'm blessed that I'm working here and I have support from wonderful people like you. You all sign up after the first year. Then I remember you came to help at
Yes.
the Wharton County
Yes,
College
we
where we
did.
were doing the events.
Yes.
So we have many, many organizations supporting us and people are volunteering with us, and that is the reason so many people are able to find matching donors. In last 2 years, I know in Houston, at least 3 or 4 people have found a matching donor.
That is so.
All the work that you are doing, all the awareness that you are spreading, we are seeing the results.
We all
It's
rise together,
wonderful.
right?
Yes, we all rise together.
The
and
whole
that's-
point of us even doing the show and having people like you come on the show is because we want to spread awareness and we want people to listen and to do good and to do something about the situations that are at hand, right?
Yeah.
If we can help one person,
Yeah, yeah. I mean, everybody knows about cancer. There are so many cancers we don't know the treatment
Yeah.
for. But this is something we know the treatment, and it's like for the basic thing that is needed. That is us, people like us. We are carrying it. We are just the walking medicine.
Exactly.
All we
You're
just need to do
absolutely
is share
right.
that.
yeah.
So it's amazing. God has given us that gift.
Yes.
Then share with somebody.
Yeah.
Yeah.
Let's get this light up. I love it. So, Acharya, I have a question for you.
Yeah.
So, are there any ethical considerations or controversies surrounding blood stem cell donation and transplantation?
See, the first thing we need to know that life means anyone's life is always is not independent. It's always depending on many people and many things, starting from parents, family, society. It can be a doctor, teacher, knowingly, unknowingly. Lots of people are involved in our life to make our life survive. है ना? Even the farmer, है ना? वो अगर फार्म ना करे तो हम जिंदा कैसे रहेंगे? है ना? Even the shopkeeper,
Yeah.
वो अगर बगल में शॉप न खोले तो आप कहाँ जाएंगे
सामान
खरीदने
लेने
के
के
लिए?
लिए।
तो our life is every moment and every cell of our life is depending someone, somewhere, knowingly or unknowingly. है ना? तो जब हमारी लाइफ पूरी तरह दूसरों पर डिपेंड है, हम कितने अपने आप को इंडिपेंडेंट फ्री समझे, someone is somewhere is doing something, that's how I am living. Even the scientist is doing research, and I'm getting the benefit of that.
Yes,
You know?
Wow. Wow.
So that's how, if I get chance to do for society or someone, there is no better way to give back to the society. So that is the fundamental thing every single person should understand, कि आपको कुछ ना कुछ देना या गिव बैक करना जरूरी है. दैट्स हमारे ऋग्वेद में एक बड़ा मंत्र आता है, मोघम अन्नम विंदते अप्रचेता सत्यम ब्रवीमि बधाइत सतस्य. इसका सिंपल मीनिंग है, जो व्यक्ति सिर्फ अपने बारे में ही सोचता है वो अकेले पाप या वो सीन जिसको कहते हैं वो पाप ही खाता है. ही इज द ग्रेटेस्ट सिनर ऑफ द वर्ल्ड हु थिंक्स ओनली हिमसेल्फ अबाउट हिमसेल्फ आल्सो. हमारे यहाँ एक तैत्तिरीय उपनिषद में बड़ा ब्यूटीफुल मंत्र है. जब ग्रेजुएशन सेरेमनी होता है तो जो आचार्य है, द टीचर, ही यूज्ड टू एडवाइस मेनी थिंग्स. वन ऑफ द एडवाइस इज दैट श्रद्धया देयम अश्रद्धया देयम श्रिया देयम ह्रिया देयम भिया देयम संविदा देयम. यू हैव टू गिव. जब आप कॉलेज से बाहर जाओगे, गुरुकुल से पढ़ने के बाद अपनी लाइफ में सेटल हो गए, तो मेक इट ए हैबिट टू गिव समथिंग, टू डोनेट समथिंग. वो देना आप रेस्पेक्टफुली दो. अगर रेस्पेक्ट नहीं भी है स्टिल दो. इफ यू कैन गिव इट शेमफुली तो गिव इट. डर के मारे देना है तो डर के मारे दो. समझदारी के साथ देना है तो समझदारी के साथ दो. बट गिव एंड गिव. यू हैव टू डोनेट समथिंग. You have to give something to society, because your life is not what you made, it's made by others. So make it a habit to give.
Wow.
अब सवाल है कि क्या दें, what to give.
yes.
सिंपल थिंग है कि आप ऐसा कुछ नहीं देना जो आप बोरो करके लाना है. तो वो दो जो तुम्हारे पास है. अगर पैसा है तो पैसा दो, नॉलेज है तो नॉलेज दो, स्ट्रेंथ है तो हेल्प करो, और कुछ नहीं है तो इमोशन है तो इमोशनली भी हम दूसरों को सपोर्ट करते हैं. और कुछ नहीं, जैसे अभी गायत्री जी बता रहे थे, भगवान ने आपके अंदर इतनी सारी चीजें दी है और आपको उसका कोई भी मतलब देने के बाद आपका कम नहीं होगा. सपोज आप ब्लड डोनेट करते हैं, ब्लड सेल डोनेट करते हैं, अभी आप डिस्कस कर रहे थे, ये कितने जल्दी वो रिकवर हो जाता है. सो यू आर गिविंग विदाउट लूजिंग एनीथिंग, एंड यू आर गिविंग द मोस्ट ब्यूटीफुल थिंग, क्योंकि लोगों की जीवन को, लाइफ को आप बचाने में हेल्प करते हैं, एंड यू आर लूजिंग नथिंग. तो इससे बेस्ट थिंग क्या हो सकता है कि आप अपनी जो बॉडी के जो भी चीजें, वो ब्लड हो, ब्लड सेल हो, जो भी चीजें, आप लीवर है या जो ऑर्गन्स है, जो आपके काम की चीजें नहीं है, या कम से कम आपको उससे कोई सफर करना नहीं पड़ता है, तो यू शुड नॉट हेजिटेट टू गिव इट. तो किसको दें? नॉर्मली आप फाइनेंशियली कुछ दें या इमोशनली दें या कोई भी चीज है. जब ए पर्सन इज एक्चुअली नीड, योर डोनेशन एक्चुअली वहीं वैल्यू रखता है. जब मुझे व्हेन आई एम इन नीड, इवन $10 आप मुझे देते हैं, उसकी वैल्यू जब मेरी जरूरत नहीं है आप $1000 देते हैं, उसके कंपैरिजन वो $10 मिलियन टाइम ज्यादा वैल्यू रखता है. बात समझ में आती है? उस $5000 का कोई वैल्यू नहीं, आप मुझे जस्ट देते हैं एज ए गिफ्ट और समथिंग, पर जब मुझे एक्चुअली जरूरत है $10 उस समय देते हैं, वो $10 की वैल्यू रखता है. यही होता है कि जो रियली कब मुझे जरूरत है किसी भी चीज की, मैं उस समय आपको छोटी सी चीज भी हेल्प करता हूँ. इट्स लाइफ चेंजिंग. आपकी जो छोटा सा डोनेशन उस व्यक्ति के लाइफ को चेंज कर देता है. तो थिंक अबाउट, हम मंदिर जाते हैं, पूजा पाठ करते हैं, कुछ भी करते हैं, क्यों? कि भगवान खुश हो जाए या हमें पुण्य मिले, वर्च्यू मिले. तो इससे ज्यादा ब्लेसिंग आपको क्या मिलेगा जब एक व्यक्ति अपने अंदर से आपको ब्लेस करेगा कि तुम्हारे कारण मेरी जिंदगी, तो भगवान भी तो खुश होगा कि तुम्हारे इस बिहेवियर को देख करके. तो इसलिए हमारे वहाँ वो गीता में एक बड़ा खूबसूरत श्लोक आता है 17 चैप्टर में, कि यादव दातव्यम इति यद्दानम दीयते अनुपकारिणे देशे काले च पात्र च तद्दानम सात्विकम. There are different types of दान, मतलब donation or charity. The best dana is you are giving something to someone even you don't know him. अनुपकारिणे, उसने आपका कोई भला नहीं किया, द स्ट्रेंजर, अगर आप उसको देते हो दैट इज द बेस्ट क्वालिटी ऑफ दान. और कब? जब देश, टाइम, प्लेस एंड सिचुएशन की डिमांड के हिसाब से. व्हेन दैट पर्सन इज इन नीड, at the same time you are helping him or her, that is the best way to give. एक स्ट्रेंजर को उसकी नीड पर सही टाइम पर जो कुछ आप दोगे, दैट इज द बेस्ट क्वालिटी ऑफ दान.
वाओ, ये जो ब्लड डोनेशन है उसी में आता है, बिकॉज जब आप ब्लड डोनेट कर रहे हैं आपको नहीं पता किसको जा रहा है, और जिसको मिल रहा है उस वक्त उसको उसकी सबसे ज्यादा जरूरत है. वाह, कभी मैंने इस तरह से सोचा नहीं था.
Exactly.
Yeah, it's
It's amazing, and also like we are mixing religion with science,
Yes,
right? It
that
does
is-
go hand in hand,
it does go.
and it's just so nice to hear this. I mean,
Yeah.
I'm in awe.
Yeah, it's दूसरा what you were saying about the organ donation,
Yes.
right? So like दो तरह की ऑर्गन डोनेशन होती है. एक तो तुम अपनी जिंदगी में दे सकते हो, और दूसरी चीज ये है कि जब तुम संसार छोड़ के जा रहे हो, यू कैन डोनेट योर ऑर्गन्स.
वो कुछ साथ में तो नहीं
कुछ
जाना है।
साथ में जा रहा. तो आचार्य जी, आपका उसके लिए क्या कहना है?
देखिए, अगर हिंदू धर्म का रेफर करूं, हमारे मरने के बाद बॉडी को हम डिस्पोज करते हैं बिकॉज इट्स यूजलेस, इट हैज नथिंग टू डू. क्योंकि आपकी जो सोल है, आत्मा है, वो इटर्नल है. मरने के बाद बेस्ड ऑन योर कर्माज यू आर गेटिंग न्यू लाइफ. दिस बॉडी इज यूजलेस, सो हम इसको रेस्पेक्टफुली बंद करते हैं क्योंकि इसका अब कोई काम नहीं है. और जैसे कि वो गीता में बड़ा ब्यूटीफुल श्लोक है, वासांसि जीर्णानि यथा विहाय नवानि गृह्णाति नरो पराणि तथा शरीराणि विहाय जीर्णा न्यन्यानि संयाति नरो पराणि. जैसे बड़ा खूबसूरत मेटाफोर देते हैं, जैसे आप कपड़े खरीदते हो, पहनते हो, अनफिट हो जाता है, पसंद नहीं आता है, कपड़े छोड़ देते हो, नए कपड़े लेते हो. बॉडी जस्ट लाइक क्लॉथ्स, सोल इज चेंजिंग एवरी टाइम. सो जब तक तुम्हारे बॉडी इज योर्स, लाइक योर हाउस, लाइक योर क्लॉथ, यू यूज इट. इसका और कोई रोल नहीं है कि इसके थ्रू आप यूनिवर्स को एंजॉय करते हो. तो इसलिए अगर बॉडी की वैल्यू हमारे यहाँ उतना ही है कि बॉडी एक इंस्ट्रूमेंट है जिसके द्वारा आत्मा यूनिवर्स को एंजॉय करता है, उसका और कोई वैल्यू नहीं है. मरने के बाद उसको दूसरा शरीर मिलेगा जैसा भी उसको कर्म हो. अगर उस बॉडी से, जैसे आपके पास पैसा है, आप किसी को हेल्प करते हो, इसी तरह आपकी बॉडी में कोई पार्ट है या कोई ब्लड है या कुछ भी है, अगर आप किसी को हेल्प करने देते हो या मरने के बाद आप बॉडी जस्ट डोनेट कर देते हो, डॉक्टर उस पर रिसर्च करे, एज ए हिंदू इट्स अ बेस्ट थिंग. जलाने से अच्छा है कि आप डॉक्टर को दे दो, उसको वो कुछ भी करे.
Wow.
It will be good for the scientific research even. That's your need. You know, religiously you don't need it.
Yeah. पर आचार्य जी, जैसे कई बार कहीं से सुना है कि हम जो शरीर लेके आए थे हमें इसी तरह का शरीर लेके वापस जाना है. अगर आंख निकाल दे दिया तो कहते हैं ना, पता नहीं कहाँ मैंने सुना था, अगले जन्म में तुम फिर बिना आंख के पैदा होते हो.
ये सब ब्लाइंड बिलीव्स है, इसका कोई रिलीजियस ऑथेंटिसिटी नहीं है, खास करके हिंदू धर्म में. तो फिर तो बॉडी को संभाल के रखते हैं. अगर आपको इतना है कि माँ बाप को अपने बच्चों को बोलो कि भाई बॉडी को संभाल के रखो, तो ना हम उसको जलाते हैं. तो वो कितना भी आपको पेनफुल हो, डेड बॉडी आप नहीं जलाओगे, सड़ जाएगा, उसमें कीड़े पड़ जाएंगे. तो बात समझ में आती है. तो आप जलाते हो, हॉस्पिटल में और आपको दो एग्जांपल देते हैं छोटे छोटे. अब तो देखिए, आप अगर रिलीजन है तो एंशिएंट इंडिया में तो कोई ऑर्गन ट्रांसप्लांट का सिस्टम तो था नहीं, तो थोड़ी बहुत जो हमें स्टोरीज मिलती है, एक दधीची करके ऋषि थे, तो उनको स्टोरी आती है कि असुर मतलब डेविल्स ने बहुत परेशान किया, तो देवताज वे फाइटिंग विद देम एंड दे कुड नॉट डिफीट देम। तो पता चला कि एक पर्टिकुलर थंडरबोल्ट, वज्र तैयार करना पड़ेगा जिससे वो असुरों को मारा जा सकता है, और उसके लिए किसी ऋषि का वो चाहिए, स्पाइनल कॉर्ड चाहिए।
Wow. Okay.
तो अब क्या करें, तो दे अप्रोच्ड मेनी पीपल, तो दधीची वाज ए ग्रेट सेज ऋषि, एंड दे अप्रोच्ड हिम, कन्विंस्ड हिम, एंड ही वाज कन्विंस्ड।
Wow.
तो उसने अपने योग से, योग साधना से अपने आप को डेड किया, और फिर देवताओं ने उसकी शरीर को काट के उसकी हड्डी बोन को लेकर, स्पाइनल कॉर्ड को लेकर के थंडरबोल्ट बनाया, उससे उन्होंने डेविल को डिफीट किया। तो मतलब ऋषि भी अपनी बॉडी को, अपने जीते जी स्पाइनल कॉर्ड को डोनेट किया है। मैसेज क्या है, ये तो एक माइथोलॉजिकल स्टोरी है, पर मैसेज इज फॉर अस कि जब जरूरत पड़े, आपकी बॉडी की कोई पार्ट अगर ग्रेटर यूज में काम आता है, यू शुड बी रेडी टू गिव, इफ यू आर ओके विद दैट, इट विल बी योर डिसीजन, रिलीजन इज नो वेयर टू अपोज इट। इस तरह एक शिवी करके और एक स्टोरी आती है, 1 मिनट लूंगा। द किंग शिवी, राजा शिवी की स्टोरी आती है कि वो एक दिन ऐसे बाहर बैठे थे, तो एक डोग, कबूतर, वो घायल, इंज्योर होकर के उनके गोद में पड़ा, तो उन्होंने देखा कि घायल है, तो उसको वो ऐसे संभाल रहे थे, तो वहां से एक बाज, जिसको क्या कहते हैं, फाल्कन है ना, फाल्कन बर्ड, तो वो आया, वो कहता है ये मेरा शिकार है, मुझे इसको खाना है। तो उन्होंने बोला नो, तो ये मेरे शेल्टर में, तो आई हैव टू प्रोटेक्ट हिम। तो अगर उसका प्रोटेक्ट करोगे, मेरा तो वो फूड है, तो मैं क्या करूंगा, मुझे खाना चाहिए ना, फिर आप जो चाहिए बोले मैं देता हूं, आपको चावल चाहिए, रोटी चाहिए, नहीं नहीं नहीं, मेरा खाना ये नहीं है, मेरा तो खाना फ्लैश है, तो आई कैन गिव माई फ्लैश, कैन यू? यस। तो शिवी ने कहा जितना चाहिए फ्लैश काट के दिया, तो वो काटते जा रहे हैं, वो फाल्कन खाता जा रहा है, पर एंड ही नहीं हो रहा। एट द एंड ऑफ द डे उसकी बॉडी की सारे फ्लैश वो खा गया, तब भी खत्म नहीं हुआ। तो it's a mythological story. The message is to protect someone who is asking something to you, कोई शरण में आता है, the Shivi king could give his whole body, the flesh, blood, just to protect someone. तो इस तरह हमारे पास कुछ स्टोरीज मिलते हैं, जो माइथोलॉजिकल स्टोरीज, जिसकी मैसेज है कि आप अपनी कमिटमेंट को फुलफिल करने के लिए या ग्रेटर वेलफेयर के लिए आप अपनी बॉडी के पार्ट्स को भी या बॉडी के किसी भी चीज को भी डोनेट कर सके हो, एंड इट इज काउंटेड एज द ग्रेटेस्ट वर्च्यू, जिसको आप पुण्य कहते हैं, वर्च्यू में काउंट होता है। आई थिंक एवरी हिंदू नोज द स्टोरी, सो वी शुड लर्न द मैसेज फ्रॉम द स्टोरी। और उसमें एक चीज मैं ऐड करूंगा, एक विष्णु धर्मोत्तर पुराण में आता है, even at the cost of one's own life, saving a person's life is more a duty than a matter of choice. So that Puran is saying that it's not your choice to give something from your body to help someone. Sometimes it's your duty, because you are not an independent person. Your every single cell of your body is because of others. So when time comes, you have to give something to others to show that you are part of the society.
Wow.
Because when you will need, someone else will stand for you.
Yeah.
So it's always mutual. You are not doing any favor to anyone. कल तुम्हारे साथ भी हो सकता है, तुम्हारे बच्चों के साथ भी हो सकता है, कोई दूसरा भी तो खड़ा होगा ना. So it's just mutual give and take. You are not doing any favor to anyone.
That is wow. So yeah, especially जैसे blood donation है, blood stem cells donation है, या मरने के बाद organ donate करना है, तो इसमें किसी का कोई नुकसान नहीं हो रहा है, तो it kind of जैसे आचार्य जी बता रहे हैं, our duty that we should be doing it.
But like he said about that king story, right, where the flesh just grows back for him. He gives it all, but I mean, in a way, it's like you're giving yourselves, but they're growing back.
They are growing back.
Yes,
Yes.
so-
So you are not losing
Yeah.
बहुत अपना कुछ नहीं जा रहा है.
But the next person is
It's
gaining something.
gaining a life, you know,
Gaining.
and like it's in the Quran. If you save one life, you saved all of humanity.
Humanity.
So, yeah. That-
और हम मोस्ट ऑफ टाइम हम गॉड से प्रे करते हैं या हम सोचते हैं कि जो रिलीजियस एक्टिविटीज करते हैं उससे हम विल बी ब्लेस्ड. क्या उससे क्या ज्यादा ब्लेस्ड मिलेगा जब जिसकी लाइफ आपके कारण सेव्ड हुआ एक छोटे से डोनेशन के कारण. ऐसा नहीं कि आपको शिवी या दधीची की तरह अपनी लाइफ कुर्बान करना पड़ता है. यू आर लूजिंग नथिंग,
Nothing.
है ना, इवन नॉट ए सिंगल पेनी. पैसा देने से तो कुछ जाता है, ये तो रिकवर हो जाता है. उसके बावजूद भी उसकी जो ब्लेसिंग है उसकी फैमिली के और उसकी और वो ब्लेसिंग जो कमिंग फ्रॉम बॉटम ऑफ द हार्ट बिल्कुल प्योर है, जिसमें कोई आर्टिफिशियलिज्म नहीं, कुछ नहीं, जस्ट प्योर ब्लेसिंग. उससे ज्यादा आपको और क्या मिलेगा.
That's so true.
Yeah, जैसा लैला said कि कुरान में भी यही लिखा है कि saving a life means
Yeah, if you save one life, you save
save
all of
the
humanity.
humanity.
Yes.
चाहे हम कुरान को देख लें, चाहे जैसे आचार्य जी ने
Yeah.
पुराणों के बारे में कहा
Yeah.
कि अगर हम किसी की हेल्प कर सकते हैं तो we
Yeah,
should
it's
do.
humanity.
It's
at
a
the end,
humanity.
It doesn't matter what religion.
What religion it is. It's the biggest
The
religion
message is
is
the same.
humanity.
The message is the same, yeah.
Same. Yeah. Wow.
Yeah.
This was an
That-
eye-opening
Yeah,
segment.
it
For sure. I'm like going back with so much.
We
Yeah.
gain more.
Yeah, we have. We really have.
Yeah, ना हम लोग ये बहुत सारी organizations हैं, they do the blood donation, the stem cell, like we always think that they are doing the great job. Now आचार्य जी की बात सुन के लग रहा है it is their everybody's duty
Yes.
to donate, and if you have a facility you can arrange that and the other people can donate. So it's our duty, we should
As human
all as a
beings,
human
yes.
being we should be doing these things.
Yeah.
Yeah. Wow.
Well, it seems like it's already at the end of time. It's 12 o'clock. Time
Wow.
has passed so quickly. So thank you for joining us here. I mean, we've learned so much. Thank you, Acharya ji.
Thank you.
It's been
Thank you.
an eye-opening segment for sure. Again, like you mentioned, if they want to donate, to text CURE to 61474.
That is correct.
And this is a way to get your kit.
Kid. And I'll give my number also.
Yes,
If you have
please.
any question, reach out to me. My number is 281-780-1379. 281-780-1379. And I would like to thank you, Sasha and Lala, all the Titan. It's like you guys are amazing.
Thank you.
Really, I thoroughly
We love
love
you too.
coming here.
Thank you so much. You are listening to your Chai Time Girls here on 103.5 Hum FM. We will see you next week, same time, same place. Take care. Bye-bye.